Hello, everyone. Thank you for tuning in. Today, I would like to talk about survivors of natural disasters. These last couple of weeks have been filled with natural disasters, from hurricanes to earthquakes, not only in the US, but throughout the world. So today I wanted to talk about what we can do to help individuals that have survived these experiences. So be it if you have a family member, a close friend that has gone through this, or you have gone through this, I think you might find helpful some tips that I am going to give you today. So one important thing to know is that after an experience of complete uncertainty, terror, our brain goes into survival mode. And sometimes what happens is that we stay in that survival mode even after the event has happened. And that can cause a variety of symptoms. So one thing that's really, really important to know is that the symptoms can occur at different times. So it can occur days after, it can occur weeks, or it can occur months or even years after. So we have to be very mindful. If we see some symptoms that start to appear, if we see some things that are different to this person's personality, to what we're used to seeing, we see some changes, even if it's a year from now, it's important to be mindful that symptoms don't appear immediately. It depends on the person's history, on how they process their emotions, on how they express their emotions, of what other experiences they've had and how they've dealt with them. So it's very, very individually based. So it's very difficult to predict something and say, okay, this is what will happen and this is when it will happen. Because it depends on the person's experience and life. So there's a couple things that I would like to share with you for you to observe. And if you see any of these symptoms, you might want to pay attention and recommend, and I'll also share with you some things that you can do to help. One thing before I forget, children are more at risk than adults to develop symptoms of anxiety, depression, post-traumatic symptomatology. The reason is that children don't have the skill sets, they don't have the tools to process experiences. And by processing, I mean we need to give meaning. We need to be able to express how we feel. We need to label. We need to name it. And children don't know how to do that, right? They're starting to understand their feelings, and they're starting to learn about all these internal experiences that they have. So many of them don't have the words. They don't even know what it is, and they don't have the capacity. So that is why we have to be particularly observant with children. Okay, of course, with adults as well, but with children, the incidence is higher. So the basic symptoms that we have when we experience traumatic experiences are depression, anxiety, and post-traumatic. And sometimes it can develop into PTSD, which is post-traumatic stress disorder. So I'm going to give you some basic guidelines of things that you might be mindful of and observant of. So if you see that the person is having just sudden anger outbursts, or is being more irritable than normal, is having, intense reactions to situations that are not quite worthy of those responses, you might want to take a look at that. You also need to pay attention to any signs of anxiety. And the signs of anxiety, can be, there's certain physical symptoms like heartbeat racing. We need to take in more breaths. We need air. There's air missing. There's that sensation. There's tingling. It can be tingling in the hands. Usually it's in the hands and the feet. Sometimes it even comes with, kind of a sensation of pressure in our chest, the sensation that something bad will happen, being unable to relax, feeling very jittery, shaky inside, feeling uneasy, kind of the need to move and to do something, feeling wobbliness in our legs. Those are all symptoms of anxiety. Now, there's other symptoms that have to do with depression and also post-traumatic stress disorder, right? Which are kind of feeling withdrawn, disconnected, cut off from other people. So if you notice that, very distant, very quiet, very, kind of inside of themselves, not being able to enjoy things that they used to, not enjoying situations or enjoying people, avoiding places, not doing things that they used to do and that they used to enjoy and that they used to be interested in, having difficulty concentrating. So sometimes it comes with concentration, with memory, very, very distracted or into their own life and thoughts, kind of internal world, daydreaming a lot. Having issues with sleep. And here it can be either too much or too little. So either wanting to sleep all the time or not being able to fall asleep or not being able to stay asleep for a long time. So sometimes they wake up and can't go back to sleep again. A change in the patterns of appetite, either wanting to eat all the time or not having appetite at all, kind of not wanting to eat. Also feeling easily startled and very jumpy, just feeling jumpy. And you can see that, if there's a sound or something, just, and being watchful. Again, having this sensation, that something bad is about to happen. Feeling very, very upset when reminded of the experience, whatever that is specifically for this person. But when anything reminds them of this experience, they feel very, very stressed, emotional. They feel stirred up when they're reminded. And also having repeated thoughts, images that come up, memories, dreams of the situation. So if they keep on coming and coming and they can't avoid it and they try really hard not to think about it, they try really hard, to avoid anything, but they can't. It just comes up and it's very disturbing. So if you notice any of these symptoms, right, and to a degree that they start to get in the way of the normal living of this person, there's a couple things that we can do. So the first one, do recommend going to a specialist. When we don't pay attention to our inner world and we think, well, if I just leave it there and don't pay attention to it, with time, it will get better. It won't. It will actually get worse. So if all these symptoms have started to arise, that means that there's a lot of stuff underneath that's causing these symptoms. So remember, all these are symptoms, and symptoms are manifestations of something deeper that's really happening inside. And that is what we need to deal with. That's the core issue. That's what we need to work with. So encourage this person to seek professional help. Okay. So is professional help the only help that they need? No. One of the most important things for individuals that are going through or have gone through a traumatic experience is support. And that's where you come in. People need support. They need to feel supported. There's nothing worse for a human being than feeling disconnected and alone. So you being supportive can help. So how can you be supportive? So first, help them take care of their bodies. That is really important. You know, eat well, drink enough water, exercise, and I'll put here the sleep thing. And this is a tricky one because, of course, they can't sleep because all these things are happening. But there are things that we can do to help relax our muscles, right? So, for example, taking a hot bath, that helps relax muscles. I love the idea of essential oils. So you can put those in your bathtub, or you can put those, you know, the little drops, and have that in a diffuser, whatever it is that you want, but you can use, you know, lavender is a good one for relaxation. So you can help create an environment, right? Where there's different things like, so you have hot water, and hot water relaxes muscles. That's what it does. Then if you have these, you know, different smells, those do affect us as well, right? So you can have calm music. So you can have all these different things, you know, set it up. And they will also feel very pampered by you, you know, if you help them get this ready for them. Another thing that you can help with is listening. And this is sometimes difficult because listening is not only, you know, okay, give it, you know, talk to me again about whatever you're talking that I might be annoyed at, or, you know, I've heard it all these times and I really don't know what to do. Sometimes when we hear a lot of it, we feel powerless and we feel frustrated. So check in what is happening inside of you as well, so that you can really be support. And when I say listen, there's 3 basic components in a good listening skills. So the first one, it's empathy. But I know you know, getting where this person is coming from. And again, this gets tricky when symptoms start to appear like a year later, right? So you have to be very mindful and say, you know, maybe these things are related so I can be more patient, right? Be validating. And that comes in with the third one, that is being non-judgmental. They all come together, right? But validate their feelings. Don't judge them. Don't tell them how they should feel, but just listen to how they do feel, right? And help them normalize their feelings. You know, after this experience, it is normal that you would be feeling anxious. Because one of the things that happens when we start experiencing these symptoms is that we start feeling that there's something wrong with me, right? So normalizing it is important, recognizing it, validating it. And with this comes allowing them to express their feelings, their thoughts. All that is part of the processing aspect that is so important. So if you help them put words to their feelings, if you validate those feelings, if you don't judge those feelings, if you allow them to have a safe place with you, that is healing. And it's healing, and I'll do another video about what happens in your brain, you know, when you feel safe. But what you're doing, right, is exactly setting up the brain to calm mode, safe mode. And that's exactly what we need to heal. One more thing, 2 more things actually. So you can recommend, you know, some exercises of mindfulness and relaxation, maybe meditation. All those are great exercises to help soothe, to help calm down. So that is really important. And you can provide that as well. One last thing, have fun, play, enjoy. I can't stress enough how important it is to laugh, to have fun, to play in the healing process, and actually in your life in general. So yes, enjoy it. Enjoy with them, play with them, do things that you like doing, and laugh. I hope that this was helpful for you. and that it provided some information that you will find useful. If you have any questions, if you have any comments, I am here, always very happy to answer and to have a conversation with you. I will see you next week. Take care.